All right, let's talk about something that comes up all the time: alcohol and your heart. Today, we're going to dive into some of the latest science to really figure out what's fact and what's fiction. Let's get right into it.
We've all heard this, right? It's that comforting little piece of advice you hear at dinner parties. A glass of wine is good for you. But as science gets sharper and more precise, that old idea is starting to look, well, a lot more complicated. So is that daily glass of wine really a health boost? Or is there another side to the story we haven't been told? For years, the story seemed pretty straightforward. You had all these studies, especially about red wine and antioxidants, that suggested, hey, maybe moderate drinking is part of a heart-healthy life. And let's be honest, that was a pretty appealing idea that a lot of us were happy to go along with.
But this is where the plot thickens. The newest research is asking a really important question. What if the problem with alcohol isn't just about heavy, long-term drinking? What if there are subtle, totally invisible changes happening to our hearts, even with moderate drinking, long before any symptoms ever show up?
Okay, so let's get to the core of this whole thing. We're not talking about the kind of heart problems you can feel, like a racing pulse or chest pain. No, we're talking about the silent, almost microscopic signals that your heart might be sending out, signals that, frankly, we're only just now learning how to read.
The key phrase here is subclinical cardiac damage. It sounds complicated, but the idea is simple. Think about it like tiny, hairline cracks forming in the foundation of a house. You can't see them from the street, you definitely can't feel the house shaking, but they're there, and they're slowly weakening the whole structure. That's exactly what we're talking about with the heart.
So this is the crucial difference, right here. On the left, you've got the obvious stuff we all associate with heart trouble. But on the right, that's the new frontier. These are the silent signals, tiny changes in the heart's actual shape, a dip in how well it's working, or even just shifts in the levels of certain proteins in your blood. These are the real early warnings.
So what does this damage actually look like? Well, atrial enlargement literally means the top chambers of your heart are getting stretched out. Increased heart wall thickness, that means the heart muscle is bulking up because it's working too hard and not in a good athletic way. And diastolic dysfunction, that's just a fancy way of saying the heart is having a hard time relaxing between beats to properly fill up with blood. These aren't theories, they're real physical changes that are being linked to alcohol.
Now this might all sound a bit alarming, but here's the really good news in all of this. Science isn't just pointing out the problem, it's also finding the solution. We actually have the tools now to spot these tiny changes, which gives us an amazing opportunity to step in way earlier than we ever could before.
And finding these clues is so important. Research is making it pretty clear that regular alcohol use significantly boosts the risk for serious conditions later on. The big one is atrial fibrillation. That's a chaotic, irregular heartbeat that can lead to some really nasty stuff like blood clots, stroke, and even heart failure.
So, how do doctors even find these clues? Well, they have a whole new toolkit. They can look for specific biomarkers in your blood. Think of them as little red flags for heart stress. They can use advanced echocardiograms, which are basically high-def ultrasounds of the heart, to literally see those changes in structure. And you know where it all starts? With a simple, honest conversation about how much you drink.
All of this is really pointing to a massive shift in how we think about heart health. We're moving away from just reacting to problems after they're obvious and moving toward being proactive. It's about a new kind of checkup, one that's all about prevention.
This slide really says it all. The whole philosophy is changing. Instead of waiting for someone to come into the ER with chest pains, the goal is to spot the risks and the subtle signs early and manage them before they ever blow up into a full-blown health crisis. It's about playing offense, not just defense.
And for doctors, the game plan is becoming refreshingly simple. Step 1, just ask about alcohol use, directly and without judgment. Step 2, based on that conversation, assess if there might be a hidden risk. And Step 3, if the risk seems there, recommend using these new screening tools. It's a clear roadmap to catching things early.
So, after all that, what does this mean for us in our day-to-day lives? Well, it means it's probably time to take a more honest look at what we personally consider moderate and what a truly healthy lifestyle looks like for our hearts.
Okay, so if you're going to take away just a few things from all this, let it be these three. First, that old idea that moderate drinking is completely harmless, well, new science is seriously challenging that. Second, the good news. We can now find those early warning signs before you'd ever feel them. And third, and this is the most important one, the most powerful tool you have is just having an open, honest talk with your doctor.
Look, the point here is not to scare anyone. It's the exact opposite. It's about empowerment. It's about giving you the latest info so you can walk into your next checkup and be a real partner in your own healthcare, asking the right questions.
So we'll leave you with this question to think about. Knowing that this silent damage can start early, what does moderate drinking really mean for the long-term health of your heart? It's a question that doesn't have one simple answer for everyone, but it's one we are now so much better equipped to explore. Thanks for tuning in.